And welcome to part 2. We are back answering more questions about asymptomatic coronavirus infection and asymptomatic transmission of coronavirus. You guys had so many questions. I couldn't get through them all in the comments, so I figured I'm going to come back and do a couple of videos. All right, let's jump right in. A viewer from Facebook says, how long can you be asymptomatic? In other words, if I'm asymptomatic with COVID, can I be asymptomatic for 3 months and just be potentially spreading it? Excellent question. A lot of you have asked me about that. How long do you stay asymptomatic? Okay, remember, this is someone who has COVID-19. It's just that they don't know they have it, and other people don't know they have it because they don't have the symptoms. My suspicion is that you only are asymptomatic with COVID for as long as that COVID infection is running through your body. In theory, and this is my supposition, your infection shouldn't be any different necessarily than someone else's. It's just that you don't necessarily know you have it because you don't have symptoms that tells you the case. So do I expect somebody that's infected with COVID who is asymptomatic to have infection for 3 months? No, because people who are symptomatic with COVID don't have it for 3 months. Does that make sense? The infection duration should not necessarily be any different. It's just that you don't know you have it when you're going through the infection. Of course, I always have to say we're going to learn more about this. There's so much we don't know. That's my best medical guess at this time, though. Question from a Facebook viewer. Does this mean you don't need medical care if you are asymptomatic with COVID infection? Do you just heal by yourself then? Well, that's a very great question, and it's tricky in a way. The idea is, remember, many people with COVID infection who have symptoms have mild to moderate disease and don't necessarily need the hospital. And what we do is we tell them to quarantine and to take care of themselves and to monitor their symptoms and do supportive care and things like that. So we're giving that advice to them. Let's say you don't have symptoms and you have COVID-19 infection. Well, you would just be going about your daily life. The problem, again, is we don't know you're infected. And if we did know, we would still tell you to quarantine and take care of yourself. The likelihood is if you didn't have symptoms, you'd probably be feeling mostly fine, and there wouldn't be much to take care of symptom-wise. And thus, yeah, your body would essentially be healing itself. But remember, we know that also happens with patients who have symptoms because most people still do have mild to moderate disease. But once again, I have to say, if you are asymptomatic with COVID-19, it means you don't have symptoms, but you have the infection. It also means you can spread it. So my last message for today is to remember, wear your masks, because these masks help protect other people against us. Because if we happen to be one of these people that are asymptomatic, we could still spread it and not know it. So wearing masks protects them, and it also helps us. Guys, I hope this was helpful. Please share this video. And if you're interested in sending stars, I answer your questions first. I'm Dr. Jen Caudle. I will see you soon.